Welcome to another episode of Knowey Parenting. We shall continue our discussion on head injury. What are the indications to get a CT scan of the head in a child with head injury? Some of the common indications are if the child is less than 1 year old and he presents with a huge bruise. The other indications can be if you're suspecting fractures or if there is a change in the brain functioning, if there is weakness, loss of sensation in any of the limbs, or if the patient has presented with prolonged episode of unconsciousness lasting over 5 minutes, or the child has constant vomiting of at least 3 or more. CT scan can also be asked if the patient was involved in a high velocity accident. Well, going ahead, what are the symptoms of head injury? The child may present with a variety of symptoms, the commonest being headache, dizziness, confusion episodes, or repeated vomiting, or even unconsciousness or having fits. What is the management of head injury? The management of head injury depends on how severe the problem is. Minor head injuries can be managed at home or under close observation by a doctor. Painkillers are given, the child is advised rest, and ice packs can be used to place on the bruise or abrasion few times a day. It's extremely important to keep a close eye on the child to make sure they are not worsening. In serious cases or major head injuries, surgery is opted. The whole idea of surgery is to quickly remove the bleeding inside the brain or reduce the swelling. The management of any head injury depends on a calculation called as GCS. It is a score of the brain function and it takes into account the vision, the movements of the child, and the ability to understand and talk. GCS gives us a quick tool to analyze the brain functioning. The maximum score a child can get is 15, and any score less than 15 needs to be reviewed by a doctor. In a child with head injury, what are the danger signs? Seek immediate medical help if the child appears drowsy or has severe headache or constant non-stop vomiting or appears confused, appears weak with speech difficulty or has fits or has difficulty in vision or presents with bleeding from the nose or ear. Also seek medical attention if the child finds it difficult to breathe. We have so far discussed some important features of head injury and how it is managed. If at any stage you are worried about your child, then always seek medical attention immediately. Please let us know if this information was useful and help us grow by subscribing to Knowey Parenting. Thank you.